Hi, I'm Dr. Deborah Jennings, optometrist and graduate of University of Waterloo. If you're listening to this, you have dry eyes or you want to learn about them. I have dry eyes too. So I'm going to explain the basics of dry eye, disease, causes, and the definition. That is if you're interested. And I also will explain why your eyes water. I have multiple patients come to me and they go, how can you say I have dry eyes when they water? Yes, I will address that too. So let's get at it and learn about dry eyes. The scientific side of tears is very complex. I'm going to try and keep it simple and easy for you. Tears have a purpose. They are necessary for good vision and provide an immune barrier. When we blink, a tear film spreads across the eye, making the surface smooth and clear for optimal vision. There are 3 layers in a tear film. The outermost layer, oily, which keeps the water layer, which is underneath, from evaporating. The water layer, which is next, is the thickest, and it's needed for the vision part. Keeps things optimal for seeing. And the last layer, the innermost layer, is the mucus layer, which spreads the water layer evenly over the eye surface. These layers come from different eye glands. Each of these layers are required to provide proper lubrication. When the tears are doing their job, we hardly think of them. But if our eyes don't provide the correct quantity or quality of tears in any of the 3 layers, or the glands don't do their contribution, then we develop symptoms of stinging, itchy, burny, gritty, red, crusty, tired, and even we develop symptoms of excessive watering and blinking. In general, we call this condition ocular surface disease or dry eye. Causes don't stop at the tear film. What if the lids don't close completely or we partially blink? And worse, what if we don't blink enough? The average blink rate is every 10 seconds to have optimal vision. But if we stare at screens, this drops by 60%. The DEWS 2, a study published in 2017, defined dry eye as, you can see the screen below, okay, the definition. It is a multifactorial disease, hence it's not simple, with loss of tears, then we get eye symptoms, then concentration of the tears, that's poor quality of the tears, that leads to inflammation on the eye surface and damage to the ocular surface tissue. Dry eye can develop for many reasons and to varying degrees. Although dry eye can occur at any age, it becomes increasingly more common over the age of 50. Most elderly patients experience some form of dry eye symptoms, with women having a 50% greater prevalence over men. However, the exponential increase in new dry eye sufferers is in our youth. Why? Screen time. The brain overrides the blink rate. The information coming in, it feels, is more important than blinking, so we blink twice or once a minute instead of 10 times a minute. Our environment must be addressed, such as dry air quality from low humidity to poor quality of smoke. Example, your eyes will be drier in Calgary than in Vancouver, and worse when we are having forest fires or working in dusty places like warehouses or drywalling. Wind is another factor. Your eyes will be drier when you're having fans blow on you or when you're in air conditioning or when the car defrost is on when traveling on a plane or using a CPAP machine at bed for sleep apnea. Eyelash extensions dry your eyes too. They affect your blink frequency and offer a great breeding ground for bugs. Eyeliner tattooing can damage the glands that secrete the oil layer for the tears. And of course, what we eat or don't eat can cause dry eye. A diet high in sugar and low omega-3 consumption can be a factor. Drinking excessive caffeine and alcohol, or not drinking enough water, can be a cause. Lifestyle of stress and poor sleep is a very big factor. Wearing contact lenses affects the mucin layer, and seasonal allergies is another cause. What about the medications you take? You know, the meds that give you dry mouth. Guess what? They give you dry eye too. Anything that has an anti in its name will disrupt the tear film, such as antihistamines, antidepressants, antipsychotics, antihypertension, that is your blood pressure lowering medication, decongestants, HRT, analgesics, Accutane for your skin, cannabis, opioids, basically all pain medications, and some topical medications in the form of drops, such as glaucoma eye drops, allergy eye drops, and Latisse. Women can develop dry eye due to hormonal changes during pregnancy, menopause, or from the use of oral contraceptives. Certain medical conditions can contribute to dry eye, including autoimmune diseases like lupus, rheumatoid arthritis, fibromyalgia, diabetes, thyroid disease, Crohn's disease, IBS, celiac, and Sjogren's syndrome. I find most patients with food allergies have ocular dryness. Anytime the cornea is cut, as in refractive eye surgery or cataract surgery, a decreased tear production will lead to dryness. It is very important to have your dry eyes under control prior to eye surgeries, otherwise the dryness will be excessive following. Secondly, having a better tear layer prior to the surgery obtains better measurements, hence more optimal visual outcomes post-surgery. We can develop dry eye from eyelid misalignment, such as incomplete blinking, incomplete closure of the eyes during sleep. Yes, some people do sleep with their eyes open. Or with age, and the skin loosens from loss of collagen and the eyelid turns in and out. And lastly, with COVID-19, we have another form of dry eye from wearing masks. So instead of the air blowing down from our nose, it actually goes up towards our eye, drying them out. I am sure I have missed a few, but really look at it all. No wonder everyone does not have dry eye. An estimated 35 to 40% of Canadians suffer from dry eyes. You're thinking now, but my eyes water. How can I have dry eyes? How can this be? Well, let me explain. When you have poor tear quality, especially from lacking the oil, the outside layer of the tears, the skin over the eye becomes irritated from friction of the eyelids rubbing, similar to a blister in a shoe. The skin loosens more on the lateral corner and billows over the lower temporal lid. The water gland tries to reduce the friction by producing more water. But just by obstruction, the tears can't reach the drain from this wrinkled skin. Hence, tears flow out of the corner because the path is plugged like leaves in an eavesdrop. Dry eye will be chronic unless the cause is removed. Sometimes that is impossible. So let's now go over the treatments. Remember, if treated early, less loss occurs of tear-producing glands. Once the glands are completely gone, they can never come back. Some easy common sense tips. Take breaks on the computer every 30 minutes. Look away, stretch, and blink your eyes. Have the computer below your line of sight. Don't have it in straight ahead or above position. Add a quiet humidifier in the bedroom or by your workstation. Keep hydrated. Never have a fan blowing directly on your face.